with a roll call.
Labor, March 4th, Senator Bouchard.
Here.
Senator Furphy,
Here.
Senator Hutchings.
Here.
Senator McCune,
Here.
Chairman Baldwin.
Here. We have a full presence and full quorum. Welcome to Labor and Health, everyone. To almost the end of the session, only 5 days after today. Not counting the hours yet, but we will soon. Welcome to everyone online. This is televised, so use good manners in everything you say and do today. There are a lot of people in the world watching. We have two bills before us today, and I know we have a lot of people online to testify, and a lot of people want to testify on both bills. So I will tell you that for the survival of both bills, it's important to get them out of here today. So I'm not telling you you have to limit your testimony to any amount of minutes, but I will tell you the longer you take, the lower the odds getting both these bills through on the floor, because we're running down to the last days. Monday, we can still hear bills in committee, but it will be difficult for bills heard on Monday to get all the way through. So we'd like to get both these bills done today if we could. So with that in mind, first bill, visitation rights, House Bill 27. Representative Fortner, I believe you're going to speak with us this morning. Welcome to Labor and Health. I've heard we're the most fun committee in the Senate.
Thank you, Chairman and Committee. Happy to be here. Happy to present my bill. I'd like to start off by saying I'm going to amend the gross copy and go back to the original bill. And the reason for that is I believe the gross copy was amended so many times due to the loss of Medicare funding. And according to our Constitution, the Supreme Court ruling that allowed Medicare funding to be used as a tool to force states into mandates is unconstitutional. And the reason being, the courts and federal judges don't make law at the federal level. Only Congress can make law. And we've allowed that to happen for too many times in the states. We have allowed the Constitution, the federal and state levels to be trampled on. The rights were inherited to all people, not just the healthy people. To date, we have allowed the 9th, the 10th, the 11th, and the 14th Amendments of the U.S. Constitution to be stripped from the citizens of this nation. And we have allowed Article 1, Section 1, Section 2, Section 7, Section 36, Section 37, and Section 38, Parts A, B, C, and D, along with Article 3, Section 3, that deals with redistricting, all to be stripped out of the Wyoming Constitution, all for the dependence of federal government and federal dollars. I'd like to read my bill to you now, if you permit.
Okay, with that Representative Fortner, are you going to read the original bill to us or the amended bill? That's entirely up to you. Amendment, of course, has to be done within the committee, but if that's your desire, that's something we will consider. I know you have two sponsors here on the committee, so
Mr.
at
Chairman,
your pleasure. You tell us what you want to tell us.
I'd like to read the original bill.
Very good. Go ahead, sir.
Thank you, sir. This is an act related to public health and safety, establishing visitation rights and providing for an effective date. Notwithstanding any other provision of law, a healthcare facility shall allow visitation for a person receiving in the facility for a period of more than 5 days or 5 consecutive days. The healthcare facility shall not impose restrictions on visitation under this section. The healthcare facility shall allow persons receiving care or that person's representative to designate persons as visitors or to prohibit some or all visitation under this section. That's the bill, sir, in committee. Thank you.
This committee always appreciates short bills. They're easier to read. We don't have to turn so many pages. So thank you. Any other comments before we hear comments from departments or the public, Representative?
I do have comments. I know people that's had both parents in living facilities. They were shut down from seeing both of them. They both died within the year, and they had no family contact whatsoever, only through the phone or through nurses. They physically or verbally could not talk to their I know people in this body, and I know people in the other body that's went through the same thing. I've had numerous people contact me about doing this bill, just for the simple reason that they don't think it's fair that their loved one should have to die alone behind closed doors and they can't be with them. They would give anything to be with their loved ones at that time, at the time of death. That's why I'm here. I'm here to represent the people, just like the rest of us. So I'd like to move this along as fast as we can so the next representative can get her bill heard too. I think it's only fair. Thank you.
Thank you very much. And please accept our condolences for those losses in your family. That's not good for anyone, but we do send you our thoughts. Important. Questions, committee, Senator Bouchard.
Thank you, Mr. Chairman. So when we look at the original bill and we look at this bill, it's turned into a control bill. I mean, it just has opposite of what the whole purpose of the bill was for. So I'm trying to figure out if it's even worth voting yes on anymore. I mean, because it doesn't look like it does what it needs to do unless, I mean, it used to be the things that are in the original bill used to be what was in a patient's bill of rights that they used to hang on the wall in facilities. Now we've just totally went to just totally opposite. I get lost for words of how bad it is. So your thoughts on where we should proceed other than put a substitute bill and put it back in as a protest and send it back?
I would comment before we move on is that if it's so desired by members of the committee, we can simply strip the amendment put on by the House without doing the substitute bill. So that is a possibility. I believe that's what the representative mentioned. I believe you have in front of you an amendment that does just that. So that's something to consider. But go ahead, Representative Fortner, if you have comment.
Thank you, Chairman. Senator Bouchard, that's exactly my intent. This bill has been destroyed by amendments. It took away all the meanings to it, all the constitutional rights it had with it. And that's exactly what I want to do. I want to redo the bill, go with the main intent of the original bill. If we need to add amendments to it to stiffen it up through some healthcare verbiage or some facts that pertain to this subject, I would be for that, but I'm not for just throwing lame language on my bill and destroying it to keep people from seeing one another. Thank you.
Very good. Further questions, committee. Senator Hutchins.
Thank you, Mr. Chairman. Representative Fortner, just for the sake of argument, when I look at the engrossed version, just say for the sake of, wow, this is the very first time I've seen this and it looks okay, just for the first time. So my question to you, again, for the sake of argument, do you have a problem with some of the protections the hospital or the healthcare facility may want to put on a person coming into the facility? What if I have a specific disease and they don't know about it? Is that, in your mind, a violation of our Constitution? Or is it, hey, we want to protect everybody. We want to allow you to visit your family. We have a special place for your family and you to meet and visit, but we want to make sure that you're healthy as well when you come into our facility. Do you see a problem with that?
Representative Fortner, go ahead.
Thank you, Chairman. Senator Hutchins, I have no problem with face masks, that kind of stuff, when they go see their loved ones. I mean, we've done that out in the public, on the streets and the grocery stores and everywhere else right now. So I'm still doing it. I have no problem with protective equipment around the patient to prevent patients from getting sick. But at the same time, if they're in the process of dying, for example, then I don't see why they would even need to do that, because they'd be in their last stages of life, and they would give anything, even if they know they was going to die, even if he was bringing the COVID or whatever to them, they're limited on life anyways. So I mean, there's instances you probably wouldn't even be necessary, but if they required that you had to have a mask, and you had to sanitize your hands so you could go in there and be with your loved ones, hold their hand and rub their head a little bit or whatever you got to do to comfort them, to let them know you still love them. There's times in our facility at home that they had died, and you'd hear from the parent or the guardian that they got a letter that said in the end, when they cleaned the room, they wrote a letter that said, why did you leave me? You know, what did I do wrong? You know, things like that. So, I mean, they would do anything to get that love, that special love that's required at the end of life, headed into death. That's where I'm at. That's what I want to provide for them with this bill. I don't want anything later on to say, oh, we're in COVID again, or we're in some other epidemic now. We'll revert right back to the federal government, to this law that the Supreme Court made, which is unconstitutional, and enforce it at the state level. That's not acceptable to me.
Any further questions, or are you ready to move on to other testimony? Ready to move on? Thank you, Representative.
Thank you
Stand
very
by. We
much.
may get you back up here eventually.
Okay,
Thank you very
thank you.
much. Let's start with departments. I see Department of Health is here. Welcome, Director.
Thank you, Mr. Chairman, members of the committee, Stefan Johansson with the Department of Health. I'll be brief in my comments. Just wanted to say to the committee, we understand where the sentiment of a bill like this comes from. The past 18 months to 2 years have been very difficult on healthcare facilities. We operate 5 of our own in the Department of Health. And the issues we had to deal with, both in terms of what was necessary to protect residents, as well as restrictions that came from the federal government in various regulatory areas, were extremely difficult, heart-wrenching in some cases. I would remind the committee that we oversee the Medicaid program and not the Medicare program. There's been a lot of discussion with a bill like this from facilities around the state, healthcare providers concerned that state law pits them against federal law or rules in certain scenarios or hypotheticals, and could lose Medicaid and Medicare funding. The Department of Health here really only has involvement in the Medicaid side, which, as you know, is in general a 50-50 split, state funds and federal funds, where Medicare is entirely a federal program. And in some cases for hospitals and other facilities, Medicare funding is often the majority of the business model. I think that's a lot of the concern with various iterations of a bill like this is as we know, facilities elect to participate in those programs. The state of Wyoming elects to participate in the Medicaid program, and by nature of that accepts various conditions of participation that must be followed. I mean, that's the bottom line of participating in the Medicaid program. And sometimes there's some unfortunate realities there with regulations that we do or don't agree with as a state. But those conditions are essentially agreed to by being a part of the program. I would close, Mr. Chairman, by mentioning that with the issue of visitation, especially in long-term care facilities, that changed during the pandemic. That was an emergency regulation, a rule from the federal government, which it evolved. And it's evolved today to be certainly less restrictive, and we're very happy to see that. Traditionally, Centers for Medicare and Medicaid Services, CMS, has always encouraged, especially in long-term care, encouraged visitation. So I would mention that because the visitation restrictions because of the COVID virus were very new and very difficult to implement, but certainly not something that I believe is part of the canon of CMS regulation now. Is it possible? Yes. To the previous speaker, is it possible in a new scenario or a new disease to see other restrictions? Yes, and they can be very frustrating. But it really does become a regulation and a condition of participation that we have to follow, and our facilities have to follow if that funding is wanted to keep delivering these services. Again, I don't mean to be overly blunt, but that's the reality of these types of programs, whether it's on the Medicaid or the Medicare side. And this, both with what we control in our facilities and what other facilities and providers have had to deal with during the pandemic with federal regulations, it all comes down to this balance that we were learning every day in the pandemic and trying to keep people safe, but also, not be overly restrictive. And I sympathize with all of our providers and facilities that were every day trying to juggle those rules and regulations coming down from on high from the feds, and also trying to keep their residents safe, because especially in some of these facilities like long-term care, we knew how vulnerable some of those folks were. way more vulnerable than the general population. And so it was a daily balancing act. And I know it's pitted a lot of us against each other, which is unfortunate. But Mr. Chairman, I'll close there and happy to answer any questions on behalf of the department.
Senator McEwen.
Thank you, Mr. Chairman. Two questions. First question. So what I'm hearing you say is federal funding is more important than the people of this great state and their needs and feelings. That's my first question. My second question is, have you read 42 condition of participation, infectious control? Have you read that rule?
Mr. Chairman, Senator McEwen, your first question, absolutely not. I'm not saying that federal funding is more important than our residents in Wyoming or the residents of our facilities. My point was it is a balancing act because the funding is shared between state funds, federal funds, and other sources. In terms of the reference you mentioned, Title 42 of state or 42 CFR on the federal.
Federal.
Mr. Chairman, Senator McEwen, very aware of 42 CFR, probably couldn't quote it to you directly. It's relatively lengthy.
I spent the morning reading it. Thank you,
Follow up,
Mr.
Larry.
Chairman. I spent the morning reading it. Nowhere in there does it say if we don't follow federal rules, we'll lose funding. In fact, it says just the opposite. So every time we have these discussions, it's always, oh, we're going to lose federal funding. Oh, we're afraid of the big boogeyman. And we are allowing patients to suffer for, even if it did cost us part of our funding. I don't see how we can use that as an argument to let somebody die alone. There's this new thing out there, and I experienced it also. My mother-in-law got COVID, went to the COVID ward, got finished with COVID, and they brought her back down, and she still couldn't see anyone. She died 3 weeks later. You know what they called it? Failure to thrive. Just quit eating. And we're going to do this for federal funds? Thank you, Mr. Chairman.
Comments, Director?
Mr. Chairman, Senator McEwen, certainly sorry to hear about your loss, and I think we've all experienced some of that. It's heart-wrenching. I do, again, this is a difficult issue. I don't want to sound hyperbolic or exaggerating that, a law like this passes and we lose federal funds or our facilities lose federal funds the next day. The issue that's not spelled out in the regulation that you're mentioning with infection control is not there for federal funding because it is a process with all of the rules that CMS or the feds put in place. There are surveys that happen to assess those conditions of participation. And if a condition is not met, it's not that the facility or the state loses that federal funding the next day. There's a process to come back into compliance. There's a process to fix that. There's a process to contest it. There's survey tags and all kinds of bureaucracy that happens. So if I was sounding hyperbolic and saying that if this passed and effective July 1st, we lose all of our federal funding in Medicaid on July 2nd, that's certainly not the case. The issue is that I think we're trying to, again, we don't have a position on this bill. This is a policy call for our state policymakers. We're just here to point out what those impacts might look like if facilities have one direction from the state and potentially, hypothetically, because again, it was an emergency type regulation that led to visitation restriction, have another direction from the feds in a program that they participate in. So certainly didn't mean to exaggerate, Senator McEwen.
Art.
Thank you, Mr. Chairman. We're talking about these emergency regulations. The problem is that we have taken this to such an extreme that I get phone calls from people that can't even get prescriptions filled because it's off label and it's still happening. We have taken this so far the other way. And here's what I'm seeing is that the people are starting, they're seeing something totally different on the outside than what we're seeing on the inside. Because the people that testify in here that work for health facilities are talking a different language than what we're seeing on the outside. We know that there's been people that have been treated, that didn't go through the protocols that were on the inside, and they're healthy today. Some of these things that we did, they killed people. We said, no, we're not going to do alternative treatments. That stuff doesn't work. That's snake oil. If you go back and look at the original awards that Fauci got on cytokine storms and cytokine reactions, he's an award-winning doctor for those things. You could scratch out the HIV in those cytokine reports and just put COVID in there.
Committee and Senator Bouchard, remind me, we need to stick to the bill because we're going to lose
Mr.
time.
Chairman,
So go ahead, sir.
This
but
is
stick
how
to the bill.
bad this is.
We all know how bad it is. We've all been there. You need to stick to the bill. If we can get through the bill, please. You have a question for the director to write to the bill.
This bill in the original form means that they'll have to figure out how to do things to accommodate someone who has to visit. When we see somebody who comes in and they're in bed because they can't stand, and their family member is standing and they can't come in and be with them and hold their hand, that's a death warrant for that person that's laying there because they don't even know where their family member is. And that's what this bill is about. We have to sit down and say, look, everybody's smart enough to take a bill like this. It's a one-page bill and say, we're going to have to figure out how to accommodate the visitor, because that used to be, there was a patient's bill of rights that used to hang on the facility walls. Now we've taken that stuff and thrown it away because of what this other bill says. That's where this is at. I mean, don't you think? So here's my question. Aren't the facilities smart enough to take a one-page bill and figure out how to make this work?
Mr. Chairman, Senator Bouchard, I certainly won't speak for all of our facilities. Again, our position is neutral on this bill, just pointing out some of the impacts. And I think from the Department of Health's perspective, we want all of our residents in our facilities and elsewhere to have appropriate and frequent visitation. In fact, we operate some safety net facilities where I wish we saw more visitation. Our patients and populations often don't have anybody. Family, friends, guardians, et cetera. It's tough. I agree with you, Senator, that some of the circumstances and some of the scenarios that we heard about, some of which we experienced, rip your heart out during the pandemic. This is a balancing act between wherever you come down in your position on what happened in the virus during COVID and the policy decisions that either were or were not beneficial. It was a balancing act between keeping vulnerable people safe and keeping restrictions as less as we could, both on the state level and with the federal regs that we saw come down. So I'll leave it there, Senator Bouchard, but I understand the sentiment and certainly don't disagree with you, but I won't speak for all of our facilities because those operationally are probably very different from ours.
Okay, further questions, committee, you ready to move on? Thank you, Director. Okay, that's the only departments we have here. Let's have professional organizations if we can. Nurses, hospitals, whatever we have out there. Come on up. There's 4 chairs. Daylight's burning. Welcome, Ms. Ducklever.
Thank you, Senator Baldwin, members of the committee. Tony Decklever with the Wyoming Nurses Association. And originally, when the bill came out in its original form, we were in opposition to it. The amendment makes it a little bit more palatable. And this is because from a nursing standpoint, we as nurses are the people that stand between the visitor and the patient. Our job is to be the patient advocate. And our job is to make sure that the patient stays safe under all circumstances. The original bill is so broad because it allows any visitor in any facility And basically there are no restrictions. It feels like the facility can't impose any restrictions at all. We just have to let anybody in that wants to come in at any time. Long-term care facilities, hospitals, they all have visitation policies already. This didn't become an issue until COVID. And as nurses, we are the ones that are with the patients that are dying without family. And it hurts our hearts just as much as anything else. But I can tell you, as a practicing nurse, I have sat with patients when they're dying pre-COVID, because some people don't have family, or sometimes family can't get to the patient in time. Sometimes visitors are not, they become more of a hazard than a help. When I worked at the hospital, I worked in labor and delivery. We had very strict visitation restrictions, because you can't just allow anybody and everybody to come in when a mom is having a baby. Nurseries have very strict visitation policies. ICU has a very strict policy for how many can visit and during the times that they can visit. And it's because when people are in healthcare facilities, they need healthcare. And that's what our job is. So when we have a lot of visitors, they get in the way, the patient can't rest. There's lots of different things. Now, when people are dying, that's different. I totally get that. But the bill doesn't say just for people that are dying. It says for everyone at any time. We encourage visitors. The Joint Commission on Patient Rights states that the facility will establish a policy. And I think that the facilities do have their policies. They're posted when visiting hours are. They're posted who can come in. They're posted the ages that can visit. Sometimes people are in isolation and we have to restrict visitors. And when you come into a hospital, it'll say right on the door, please check at the nurse's station before visiting, because we want to make sure that the visitors are safe for the patient before they go in. So there's lots of different circumstances. And so to just have one bill that just says no, it feels like it's problematic for us as the staff that worked in the facilities. So I appreciate you listening. And
Questions from Ms.
answering
Declever?
questions.
Seeing none. Oh, I didn't see your hand. I'm sorry, Senator McEwen.
Thank you, Mr. Chairman. I view the original bill just a little different. So I'm going to ask you if you'd agree with a couple statements I'm going to make. First of all, it gives you or your organizations the ability to solve the problem based on the situation any way you see fit. It just puts a requirement that the problem be solved instead of kicking the can down the road and saying it's too hard, we don't have time, and we'll lose federal funding. I get it. If someone's in ICU and all the other things you're describing, it would be reasonable to assume there's going to be limited or no visitation. But that's not what happened. We shut it down completely. But we let healthcare workers come in. That in itself is dangerous. And you would tell me they have to be there, and I would fully agree with you. I'm just telling you that the visitors should have to be there also. And it's a tough situation, but I listened to a county health officer say, if you don't wear a mask, you are breathing IEDs into the air for people. That is so extreme and so ridiculous, it's not even funny. So what I'm saying is, this bill allows you to solve the problem. That's why it's wide. That's why it's directed at you, because none of us up here are infectious control experts or doctors. So I would just ask you if you understand at least my point. Thank you, ma'am. Thank you, Mr. Chairman.
Go ahead, Ms.
Chairman,
Declever.
Senator McCollum, I understand.
Okay, further questions, committee? No further questions, further testimony. Professional organizations, and then we're going to open it up to the world. welcome to Labor, Health and Social Services. I'll let you, the four of you, decide what order you want to speak in. Introduce yourselves and go ahead and speak to the committee.
Morning, Mr. Chairman. Eric Boley, President of the Wyoming Hospital Association and Leading Age Wyoming. I'll let these folks introduce themselves and then maybe I'll kick it off and we can provide some context.
Roxanne Gorman, I'm with Quality and Risk at Cheyenne Regional Medical Center. I'm also an RN.
Tim Thornell, President and CEO at Cheyenne Regional Medical Center.
And Jeff Story, I'm an OBGYN in the community and current CMO of the CRMC.
And we'll save all of our questions until all four of them have spoken, if that's okay with the committee. Okay, proceed.
Thank you, Mr. Chairman, committee members. And I understand this is a very emotional topic. COVID has impacted all of our lives over the last 2 years. I remember finishing our session 2 years ago, and I think it was 3 days later, I was in the governor's office working on the strike team to combat COVID, and it hasn't stopped since then. There's been a lot of loss in our state, a lot of sad stories from a lot of different areas and different situations. Came here prepared to maybe work with this committee on the bill that came out of the House, letting you know that we don't like it either, but it's better than what we started out with from our perspective. We thought it was somewhat of a compromise. If we're going to go back to the original bill, and I'm not sure which way to go with our debate here, but I kind of get a feeling where we're headed. We oppose this bill, and for not because we don't think people should visit and be able to see their loved ones, but because this is so broad. And Senator McEwen, you said that we're smart people, we should be able to figure this out. I could print off a ream of paper for you right now of the guidance that nursing homes alone have received over the last 2 years. We have tried to figure it out. We have tried every possible way to allow people to visit their loved ones. We've come up with innovative ideas, and CMS has told us yes, they've told us no, they've changed. The regulations, the guidance has changed sometimes on a weekly basis, and we've been trying to keep up with that. I helped build a nursing home 20 years ago, and I ran that nursing home, and I understand the importance of quality of life and having a thriving lifestyle. I witnessed people that were abandoned in those nursing homes. And my son, I have pictures of my son riding in a wheelchair with one of our residents. He adopted him as a grandpa. I had another resident that I sat with every day at lunch, and she told me the same story. And I still looked at that chair after she passed away when I'd walk into my nursing home. So I understand. From a personal perspective, 12 o'clock today, I'm leaving to Southern Colorado to go bury my father-in-law. He died last week from COVID, and his family wasn't able to visit him when he was in the ICU ward. They were able to be there the very last day, but they all had to wear PPE. They had to decontaminate when they left the room, but they were there. So I understand how important that is. And that doesn't happen in every situation, but I also understand the science behind it. As far as figuring this out, Senator McEwen, we've tried. And I know you guys are mad. I understand. I'm mad too. Frustrated with CMS and CDC. I've been the loudest critic. I fought them every chance I get. I fought with our license and survey department, asking them to carry the message back to the regional CMS office. And they do control, they're an extension of CMS, the license and survey. So they do control, to a degree, federal funding. And things can be immediate. They can stop our ability to admit new patients. They can fine us immediately, heavy fines. They can stop the ability for us to be paid until we're in compliance. It can be for Medicaid or Medicare. Our hospitals go through survey processes. Now that we have infection prevention to worry about, we could be surveyed at any point. If a patient or family member complains against our facility, that sparks a survey, and they can go in, and now with the survey process, not only do they look at the complaint, but it opens them up to make sure we're in compliance with the vaccine mandate and that we're in compliance with infection prevention. Our nursing homes in our state wouldn't have done what they did if they had not been required to do that. Senator McEwen, in your own community, I don't know how familiar you are with your nursing home. Your nursing home administrator's life was threatened several times, not because she wanted to enforce, or not because she came up with these rules, but because that's what CMS said she had to do. Personal property was destroyed. Nurses are burned out. Nurses are sad. Nurses that used to be heroes are now vilified. And I understand that we're mad, but this is a knee-jerk reaction. And we're taking a look at COVID right now. Who knows what's coming down the pike? Who knows what we're going to face in the future? In hospitals, we do things to try to protect the patient and the public. And I'm going to let the hospital talk about that. We have done all we can within the guidance that we've received. And if you guys want us to not take federal funding, if we're worried about patients and we lose a nursing home, where are those residents going to go if we have to shut it down? And there is only so much general fund that can cover this. I think the number I heard just for Medicaid alone is $500 million a year. How long can we support them if we turn our backs on federal funding? The conditions of participation do change, have changed. We have to comply with those. They changed just a month ago with the vaccine mandate. That's a condition of participation. They've changed them on us and we have to adhere to those. So I think that the amended bill that came out of the House, while it's not perfect, and I think we have some amendments that might make it better, could be useful. I don't think that that's where this committee is going to take this. But I would hope that we could maybe work on a compromise. Nothing's going to be perfect in this, but what I worry about is what we're doing now, how it's going to impact us in the future as well. And once COVID's behind us, and just to let you know, the restrictions that have been imposed in long-term care are very different than what's happened in hospitals. But those restrictions have been lifted. And I'm excited to tell you, I looked at the graph yesterday. We have, I think, 36 hospitalizations now. It's the lowest we've been in a long, long time. 240 something active COVID cases in the state. So we're trending in the right direction. But if this thing spikes again, I can't tell you what CMS is going to do or won't do. But what if we get Ebola or something else in here that's highly contagious and deadly? We've killed 1 million people. 1 million people have died of COVID, but what if we have something else and we've passed this legislation? We are smart people. We can figure it out, but we can only figure out what we're allowed to do. And with that, I'd turn time over to the hospital.
So my responsibility within the hospital is to help with the surveys, overseeing them, and also help with our visitation policies and rules and regulations surrounding that. So we do have a lot of guidance from CMS and Joint Commission already with all of our visitation. And like Ms. Decklever said, regarding nurses being in the front line with patients, it's not always easy to be able to control all of those visitors with some families. And so by allowing anybody in anytime that they wanted to, you're putting a lot of the healthcare workers, I'm not going to go as far as to say is at risk, but they're in situations that make it very difficult to provide good care and safe care to those patients. So I'm not sure that with the original, the way it's written, having that number not be limited, especially during times like COVID. And like Eric said, with Ebola and other things that might be coming down the pike, that puts all of our healthcare workers also in a very precarious place. So.
Again, Tim Thornell with Cheyenne Regional Medical Center. And they've spoken to CMS regulations. I just want to speak just specifically to the practicality of what we all want to accomplish here. And certainly as we've all endured the past 2 years of COVID, and unless you've been in the hospital and been on the front lines and been with our nurses, it's hard to imagine what they really had to experience. And it's really exceptionally challenging. And from that, we certainly have learned, one extreme doesn't work well, and that is to have 0 visitors. But the other extreme doesn't work either, and that is to have limitless visitors. So we need to have a regulation here that while it will permit visitors to be accessible to patients, and we absolutely value visitation to our patients. We recognize that as an important part of their healing process and ultimately an extremely important part if they're not going to leave the hospital for any circumstance. And we've really found a way to make that happen. But we also have to have safeguards and safety rails in place, and hospitals are best adept to put those up. So the challenge we find with the original amendment is it provides sparsely limited ability for hospitals to put up the safety guardrails that we need to make it a safe environment, not just for our patients, but for all the visitors that come through and for our staff. We have a very fragile staff right now. I think everybody's aware in healthcare that all we've been through, and we need to keep and retain all that we have. And if they don't come to a work environment that they feel safe and protected, they're going to stop coming to their work environment. So really important for, again, applaud the efforts to say, look, we need to have something to not go to that extreme again, where we can't say 0 visitors are allowed, but we can't go to the other extreme. It'll be equally, if not more detrimental to say there's no limitations in how visitors interact in a healthcare setting, because it is a very fragile environment and a very delicate environment, and an important environment in which we want to provide the safest area for everyone concerned. And I'll leave with that in turn.
Good morning. I'll speak a little more to the practical side of this as an OB in the town, and with respect to our medical staff and nursing staff as well. First, there's the obvious risk with infectious-based issues if you do not limit visitation. Ebola was mentioned a couple of times. We don't even need to get as severe as Ebola, which has a mortality rate of 70 to 80%. If we end up with another COVID variant that has the lethality of the Delta variant and the transmissibility of the Omicron variant, we're all of a sudden talking about 10 to 15 times the number of deaths we've seen thus far from either Delta or Omicron. In an effort to minimize that spread, you separate people and minimize the interaction of the virus amongst people, allowing that virus to burn itself out over time. If we take people who are the sickest and spreading and releasing more virus into the atmosphere, you then simply continue to engender further spread of that virus as you move further. I'd like also to turn a little more to non-COVID, non-Ebola, non-emergency situations and get to what's going to happen should we ever return to normal, which we all pray will happen sooner than later. Hospital is a place for people who are sick to come in and regain their health. Part of that is rest and the ability after surgical interventions to have the appropriate care following those interventions. That is limited when you have multiple people in the room, all caring for that individual, but not allowing that individual the ability to rest and relax. Now, you say individuals can request that those visitors not be there. You've not been in the situation of how hard it is when your loved ones want to be with you to tell them, go home, I need to rest. I see this in OB extensively, very personal, incredibly bright time for most families. But the problem is most patients want their nearest, dearest loved one, typically their husband, occasionally a parent with them. They tend not to want 6 to 8 different people, but telling people you don't want them there makes it very difficult. It's much easier as the staff to be able to say, we don't allow that. And minimize it to what the patient truly wants. And I'm happy to take that on as myself. In addition, we get to the situation of cancer patients who are immunocompromised significantly. And if your family comes in, even with a sniffle or a cold, you've all of a sudden done exactly the opposite of what you're hoping to do. In that situation, a sniffle or cold, which is mild and irrelevant to us, to a cancer patient is deadly. And if we are required to allow visitors in all times, as this bill is originally written, then we jeopardize the safety and care of those cancer patients. In addition, families often create problems for our nursing staff to be able to provide that care. In a pandemic, we have staff who are already tired, and we have, even during Omicron, we had as high as 90 staff members out at one time. And so we're asking the people who do remain to extend themselves well beyond what is considered normal at any given time. And if they are having to navigate family dynamics with each room they enter, you are simply removing their ability to care for the additional patients that they're required to see only because there are no other staff to be able to see those additional patients. In addition, recovering from those procedures often require multiple tiring events for patients. For instance, after a shoulder, knee, or hip surgery, there's PT, occupational therapy, and these patients are busy. And if they're constantly being interrupted by patients, you remove the ability of those patients to rest and resume their normal health over that time frame. And so my concern with the lack of limitation on visitation is you actually serve to harm those you're seeking to protect. And don't get me wrong, visitation at end of life absolutely has to happen. Visitation with children has to happen. Visitation in deliveries and birth should happen. Those are times and events that absolutely visitors and loved ones provide as much care as the medical care provide. But there are those times it's not appropriate. And this bill doesn't differentiate any of that in its original fashion. And I think the state and the hospitals in this state are here not to serve to rip families apart or prevent families from seeing one another. We all serve the same purpose of trying to engender health in our population, and you serve to make it harder, not easier, as this bill is originally written. And with that, I'll end my comments.
Question? Oh, go ahead,
Mr. Chairman, just a couple other
Wrap it up,
comments.
because we're
I will. So we've talked about acute care hospitals. We've talked about long-term care and assisted living. The amended bill was actually amended by the chairman of the House Labor Committee, and it brought in a definition of healthcare facilities that broadened this even more and specifically defined it. We haven't talked about psychiatric hospitals. Do we want to open up visitation when part of their treatment is not to have visitors, or where there's a threat or danger to others or themselves? Title 25 patients. The bill that you're going to amend it to has no limitations for any of those. I would also just add the rights of one over the rights of many, or the protection of many. So we've had situations where we opened up visitation. This is long-term care. Family member was allowed to come in. They were supposed to adhere to wearing a mask, no physical touch, things like that. As soon as they came in, tore the mask off, went, hugged, and kissed. We had a transmission of COVID throughout the facility. And so that person came in and disregarded the rules. And then there was a spread in the facility. And we could talk about what an outbreak in a facility requires and causes, but we lost people's life. It was in your community, Senator McEwen. So we've got to be very, very careful here. We're endangering people's lives by trying to enrich others. It's a tough balancing act. And that's where we have tried to do the very best from a healthcare facility standpoint and from a healthcare provider standpoint to do that balance. But there's got to be the ability for us to make decisions that are good for all. And with that, I take any questions. Thank you.
questions, committee. Senator McEwen.
Thank you, Mr. Chairman. I've worked very close with the legacy and the staff there in my community. I take exception to you think this is a knee-jerk reaction. It's not. If we had solved this problem, and I'm not saying it's your fault, the hospital's fault, the legacy's fault, the federal government's fault, the state government's fault. I'm just saying, if we had figured out a better roadmap for all this, we wouldn't even be here today having the discussion. So at the end of the day, we can continually put up rules and regulations. And I might agree with you that this bill's a little too broad and we could neck it down a little bit. But at the end of the day, would you agree the other bill basically is a lot of words that says The hospital, the healthcare facility, the psychiatric ward or whatever can do whatever they want. And we've solved nothing. We're back to where we started, where we have, unfortunately, numerous people died alone. And we were very, very slow to react to that. So I would say this isn't a knee-jerk reaction. I would say, as we watched it in my community, it was horrific on both sides. So somehow we have to solve this. And just arguing over federal funds, you don't want us to take federal funds, tell us we'll be out of business. We're not implying that either. But what I am implying is the model we used, and I would ask if you would at least agree with this, the model we used at the outset of COVID was broken and it could have been fixed. And we hung out for 18 months almost doing the same thing. Thank you, Mr. Chairman.
Response. Anyway, Mr. Bullock.
Mr. Chairman, Senator McEwen, I would agree with you to the fact that this is not just about federal funds, but it is about rules and regulations that we have to adhere to. I would also tell you that I do believe this is a knee-jerk reaction and that we have been trying to figure it out, and we have figured it out over the last 18 months. When this thing first hit, no one knew what to do or how to respond to it. Our country was unprepared, our state was unprepared, and we've been figuring it out, and we're in a better place now. I think measures that have been put in place over the last 18 months have actually protected life, and we're in a better place than we were before. I agree with you that it is sad that some have died alone. And unfortunately, a pandemic is a terrible, terrible thing that I wish we never had to face, and I hope we never have to face again. But I would say we have been figuring it out, and we have been trying to work through this. I would tell you that CMS and CDC have not done the best job that they could, but they've been trying to figure it out as we go along. As you can see, the variants have come up. This thing's changed and morphed over time. And so I actually think we've been working on a solution all the way through. Whether we agree with the way, armchair quarterback's easy. Looking back is easy. But when you're in the heat of it, you're trying to do the very best that you can. And I think that's what everyone's been trying to do to deal with this. We could debate some of the different things that have happened with federal rulemaking or whatever. And I probably don't agree 100% with them, with what happened. But what I would tell you is that from a facility perspective, from representing hospitals and nursing homes, they've done everything they possibly can under the rules. And we're still going to be forced to adhere to rules going forward. And so I don't think this bill fixes anything for us, because we're still going to be under those same conditions of participation and rules. And it's not all about funding. It's about the ability to be there and to be able to care for patients.
Follow up, Senator McEwen.
Mr. Chairman, when the vaccine first came out, the CDC published figures on Channel 5 News in Salt Lake of about 4,000 people that died from the vaccine. Then in October, the CDC published 0. And now they're publishing more numbers. This isn't about us necessarily attacking you or your organizations. This is about people in the legislature of the great state of Wyoming. They're fed up with being bullied by the federal government. As it was said earlier, it's unconstitutional for them to give you rules and then fine you if you don't follow them. There's this thing called the 10th Amendment. So that's where we're trying to go. And I agree with you. Maybe we need to tighten this bill up a little. But something needs to be done other than business as usual. Because you think it's getting better. At the very beginning of this, my community, and I probably would guess everybody else's community, embraced what was going on. They were glad to work with the CDC. They were glad to work with the facilities. And as time went on and we learned about all this, and I'm not going to get into the argument whether this was a true pandemic or not. I believe COVID existed. So we'll just leave it at there. But as it went on, people expected things to change a little. They expected things to start happening. And as the cases started dropping, the requirements got more strict. And you're right, this isn't all about federal funding, but it is about federal government overreach and controlling things. And I do believe you all should have the right to set your visitation policies. That's where this is going. We're trying to give you the ability instead of being held up by the federal government and regain our 10th Amendment rights. Thank you, Mr. Chairman.
Okay, further comments? And I would remind everyone, both giving testimony and on the committee, we're almost an hour into this, so we got another bill sitting behind. I'm not going to stop testimony. Everyone out there can testify, and we've got at least probably a dozen people or 10 people online, most on the next bill, but we need to keep moving or we're not going to get through it. So go ahead and comment.
Mr. Chairman, Sarah McEwen, I agree with a lot of what you said, but the one thing I would say is it isn't business as usual. That's not what we're asking for. We've changed the way we've done business. It hasn't been business as usual for 18 months or 2 years, but prior to COVID, we were able to set our visitation regulations and rules within our organizations. And we want that ability, but we don't want to have it mandated that we have to do certain things. And that's what this bill does. It says it's wide open. Somebody's in there for 5 days. You can't limit visitation. It's wide open. That doesn't work. And it doesn't work in every facility. And it doesn't work with the rules and regulations that we're forced. We're kind of at an impasse here, but the bill right now is too broad. It opens the doors wide open, and we don't have any say in how we limit visitation, even if COVID didn't exist right now.
Okay, and I would remind everyone, the bill that we have right now is actually the amended one. Until there's an amendment made, that's what we have right now. It's one that came from the House. So, okay, anyone else that wants to testify from organizations? I know we have several legislators as well. It's up to you. If you'd like to testify, come on up. Good morning, Mr. Laycock.
Good morning, Chairman Baldwin. Good morning. Good morning, committee. Tom Laycock with AARP Wyoming. It's been a very spirited debate thus far. We've appreciated the conversation on both sides. Through the pandemic, we actually sit on a couple long-term advisory committees with the Department of Health, and that's allowed us to have some communication with some of the nursing home administrators and medical directors. It's been impressive and inspiring to see the lengths they've gone to allow visitation, and I think everyone in the building here ultimately is working towards that direction. There's a New York Times story that's from June 1st that points out 184,000 deaths at that point due to COVID came in nursing homes. And that's basically 4% of the population in the country taking 1/3 of the total deaths. In the state of Wyoming, we know we've done much better than that. I think we're at about 265 and about 1,400 cases in state nursing homes. That said, I think that's a nice illustration for the fact that, COVID has impacted different areas in different ways in terms of number of cases, number of deaths. And so I think our request is, as you look through this bill, is just to allow for that local control from the nursing homes, from the medical directors, because we know that the sort of one-size-fits-all mandate has not necessarily worked through the pandemic. So that said, I'll be happy to stand for any questions. But once again, our request is just to allow for the local control, the local facilities to be able to find out what's going on, boots on the ground, and make those decisions for themselves.
Questions for Mr. Laycock, committee? Done. Thank you. Mr. Winnie, proceed.
Mr. Chairman, Bill Winnie, Sublette County. What I think you're facing is you try to crack this really tough nut is a question of, is human contact significant in treatment or healthcare, particularly close family? And we hear follow the science, and sometimes I get to where I don't trust those words, because it's as if there is no science regarding touch, human contact in treatment. And I believe there is. And I find it curious the medical profession hasn't kind of talked about that side of the aspect. It's just absent in discussion. Is an open door policy where you ought to go? No, I got it. You know, this is something that gets around pretty easily. But is zero an answer? I think not either. And as Senator McEwen spoke about failure to thrive, I think human touch might have made a real difference there. I saw that in my father's end stages of emphysema. My touch made a difference to him for about 2 weeks. My wife saw something like that with her father's treatment. He was 100% disabled veteran from prisoner war camps, and she made a difference in touch with him. Subject to your questions, thank you.
Since committee. No questions. Thank you, Mr. Winnie. Proceed, sir.
Good morning. Thank you for having me. My name is Steve Milia from Shine right here. I have a master's degree in public health. I worked for Baton Rouge EMS, City of Houston Health Department, and 20 years with the Wyoming Department of Health and Infectious Diseases and Environmental Science. I agree with the bill and I support it. I also don't necessarily disagree with everybody else who's been up here. Visitation is very important. The human touch, failure to thrive. And I agree a lot with what Senator McEwen has said, Mr. Chairman. The people from the hospitals and those associations are correct. You have a general and you have private. You have a CEO and you have a mailroom clerk. You have the CDC and you have all the agencies underneath there. If you don't do what the top people say, they're going to get you one way or the other. I mean, they're going to cut your funding, they're going to fine you. Some people may even get fired. Okay. And so CDC needs to be reined in. Dr. Fauci is not the only expert. He may not be the best expert. There are a lot of immunologists, virologists, and other medical professionals out there that have disagreed with him. They've been threatened, silenced, and fired. That's propaganda. That's not science. Maybe a political agenda, whatever. But when you have thousands of those medical professionals out there disagreeing, and they get threatened, fired, and silenced from universities, medical teaching unit, hospitals, et cetera, there's something wrong with that. If visitation is very essential, you have to get in there. As you mentioned, the touch, there's been numerous studies where infants born, if they're fed and changed and they're left in the cribs and there's no touch, failure to thrive, they die. All right. I listened to the governor of Illinois, and he had his Department of Health spokesperson come up, and she said, everybody comes in, gets tested for the virus. If it's positive and they die of an alternate means, she said, if you die of an alternate means, it's classified as a COVID death. And so that raises the numbers. How many false positives have been out there? CDC has said, well, you know, the PCR test may not be the best test out there. So how many, like I said, false positives, how many people died of alternate means, but it was classified as a COVID death.
Sir,
So,
in the interest of time, stick to the bill if you can.
Okay, so I agree with Phil. I agree that it needs to be visitation rights need to be out there. And I thank you for your time. Any questions or anything?
Questions, committee? No questions. Thank you very much for your testimony.
Thank you.
Welcome to Labor and Health.
Good morning, Mr. Chairman. Thank you. And committee, my name is Carolyn Passano. I'm with the Wyoming Healthcare Association. And thank you for taking care with this bill. My members are worried about what will happen if there is another pandemic, if you will, regardless of what it is, and what their role is actually going to be. This has been very confusing and very, as other speakers have said, very disturbing. My personal experience with this was a family member that died of COVID in the hospital, not in the state. And everyone waited all night, waited the next day. No one told them what the rules were. They waited and waited. never knew what was happening. And finally, that person died without anyone being there. That was in an early stage. We're better off now that we know more. I am concerned that we are wed to the federal government through money that we take. And on Tuesday evening, when our US president in his address to the people of this United States said in the middle of everything about Midway that there was a problem with the nursing homes, that there would be more regulations coming and there would be higher fines. And he went so far as to say that those owners of facilities could be fined $1 million. That was on the air in his speech. We don't know what's coming. And I think we're not prepared. And I don't know if this bill can prepare us. I would almost ask that we have an interim study, knowing that more regulations are coming, and if more fines are coming, I don't know how people, our facilities can stay in business. And who is going to be the leader in this? With that, I would ask specifically that we ought to have an interim study on where this is and where it's going and how we're going to react, what we're going to do to save what we've got. Thank you.
Thank you. Questions, committee? Seeing none. Thank you, Ms. Fastenal. Go to green. You need to go to
Hello.
green. So not just we can hear you, but everybody in the
I'm
world.
green.
Go ahead, sir.
Good morning, Chairman, members of the committee. I'm Greg Hunter from Laramie, Wyoming. I just want to point out that back when cooler heads prevailed during the George W. Bush administration, each and every state went through and prepared a Wyoming or a pandemic response plan that addressed the 10th Amendment issues that we're talking about. In other words, each Wyoming or each pandemic plan referenced the laws that were passed by the state to implement the plan. When COVID occurred, I never heard one legislator, the public, or the governor embrace these plans and say, hey, back when cooler heads prevailed, we thought about all these things. We just went headlong into the night and people just really didn't understand. But if you actually read the Wyoming pandemic response plan, it addresses these issues and it addressed the laws. So the medical administration or communities that did this, and historically, I would suggest you might want to read Ohio's. It was like 50 pages longer, and it addressed what the Secretary of Health could do. So we've already talked about these things under cooler heads, and I say we should wait again and decide and look back instead of passing laws this quickly. Thank you very much.
Questions, committee? Yeah.
Do you
you're
have any
trying to get away.
questions?
Any questions, committee? Okay, you were right. You can escape.
Thank you.
Okay, any of our legislators in the room wish to speak? I'm seeing head shakes. No. Any other further testimony from here? Do we have anyone online that wishes to address this topic or this bill?
Mr. Chairman, no one signed up for this topic.
Okay.
However, when they ask to be a panelist, Zoom now requires them to accept that so they can testify. So just anyone who raises their hand needs to accept that once we wrote them.
Okay. Well, if anyone jerks their hand up while we're discussing here, we'll make an exception. Okay, committee, what's your pleasure? Senator, go ahead.
Mr. Chairman, I'm in favor of going with the original bill. So
Okay, we need to move the bill first.
I'll move the bill.
Moved by Senator Bouchard, second by Senator Furphy. Okay, now let's go ahead and make your comments, Senator Bouchard.
Mr. Chairman, I heard a lot of fear. And when I look at this original bill, it says that for a period of more than 5 days. Then it goes on and says the healthcare facility shall allow the person receiving the care or the person's representative to designate persons as visitors or to prohibit some or all. And in the cases where someone is in alone, where they don't have someone becomes an advocate for them in the hospitals. That solves some of that problem. And there was a case where they said that when a woman is having birth, she doesn't want to, that's taken care of in here in the bill. So I don't think the bill is that broad. I think it is a shove back. And I think it needs to be shoved back because I heard more fear. And it's the same fear that I heard before. So I would, and the reason I recommended a substitute bill, because it makes it easier to track. If we do an amendment, the committee is the only place that we can do a substitute bill for that reason. And that's so when it goes to the floor, it's much easier for everybody to see what's going on. Because these are several amendments that came to do this. I think I want to say it was 4 amendments, but at least 3. So rather than have it come back and run the amendment that way, I think it would be much easier just to take this bill and run it as a substitute bill. And that would be my motion.
And we have that option, committee. The other option is, as you said, is we can simply strike. That would be a motion to strike all the amendments from the House, but that's up to the senators, up to the committee. Comments, or go ahead, Senator McEwen.
This seems to have turned into I'm on this side of the line of scrimmage and you're on that side of the line of scrimmage. And I'd like to see this bill get out of here today. And I'd like to see the people on the other line of scrimmage, if they have ideas, work with us. We're not saying we're unreasonable. What I think we're saying is, as the system worked itself through, it did not do a good job, and we're trying to fix that. We're not trying to put hospitals out of business. We're not necessarily trying to cut off federal funding. But we are almost trying to partner with them to solve a problem. So I would like to see us get this through, and maybe it gets the 3rd reading and we don't get there. But at the end of the day, we got to give it a chance.
My suggestion to the committee, and of course, it's only a suggestion, you make a decision, would be to make an amendment to strike all the House amendments, if that's your desire. And then that a committee of the whole amendment be brought perhaps, or whichever, however you want to do a 2nd or 3rd reading, working with the interested parties in amending what needs fixed, if there's a desire to do that. In the interest of time, I don't think it's something we can work in here today. We're going to limit the other bill if we do, but I think that that's a possibility, but that's solely a suggestion. The option to that is to make a substitute bill and likewise, but go ahead, Senator Furphy.
Thank you, Mr. Chairman. Well, this original bill, as we heard today, is too broad. It does not let the healthcare facilities provide any guidance. It simply opens it up to full visitation. I can't support that. That's, as we heard from the hospital administrators, that's going to put the patients at more risk than just allowing them to have access to the patient as the engrossed bill encourages. So I can't support doing the substitute bill. I'm in favor of the engrossed bill, but so that's where I stand. And so I don't know where we're at. Are we voting for substituting the original bill for the engrossed bill? Is that where we're at?
We have not voted on. I have no motions on the floor right now. I'm waiting for one if somebody would like to make one. I see Senator Hutchins looks like she wants to talk. Go ahead, ma'am.
Thank you, Mr. Chairman. I really appreciate it. Looking at the first bill, looking at the second one, listening to the testimony, I do appreciate what the hospital community said, the nurses said. It makes sense to have some kind of limitations on who goes into a room, how they go into a room. I believe I spoke to one of the members on the healthcare community before about having safe rooms where they could go into, and I think some of the money that they received was supposed to go to creating those safe rooms to help stave off any kind of infection spread. So either way, I'm good, but I'm more inclined to like the engrossed version. But if we need to substitute it and get to work, let's do it. And I'd like to make that motion right now, that if we do substitute this, or if we substitute the bill, let's work with the community and get a good substitute bill that will help everybody, not just a few.
What I need, Senator, is I need a motion to either make a substitute bill. The other option, of course, is to take the engrossed bill and do the same thing you're describing.
Either
That would
way,
be work
let him-
with involved parties. Senator, go ahead, Senator Bouchard.
Mr. Chairman, I would like to motion to substitute the bill back to the original bill. And I think there's plenty of time while it moves through, we can amend it as it moves through on the floor. And we can work with some of the people that are having the current concerns. Of course, I'm never want to go back to this. But I think there's a couple of little sideboards we can put in and try to get everybody on the same page. But my motion is to substitute the bill back to the original bill.
Okay, committee, we have a motion on the floor. Discussion, or are you ready for a vote? Second? Now we don't need a second. That's okay. Okay, we ready for the question? All those in favor of the motion, which is to make a substitute bill and move forward. All in favor of that, say aye.
Aye.
Opposed, say no.
No.
No, so that passes. That's 3-2. So we will make a substitute bill going back to the original bill. Okay, committee. That being the case, you have the original bill in front of you. Are there any further amendments you wish to make? Anyone? No amendments, no further discussion? Go ahead, Senator McKeon.
I think we got to take a little bit of time if we're going to do an amendment. I don't think we're going to be able to do any quality work on the fly right now.
I would agree, and I see that we have two members of the committee. Right, yeah, two members are on our sponsors, our co-sponsors. And I would ask you to get together with those who gave testimony today. Come up with some amendments if that's appropriate, or what you want to do with the bill, if it goes forward, and then work from there. I will tell you up front, and it's just for discussion, is that I'll be a no on this bill as it stands because I think it's too broad. That doesn't mean I'm going to be a no on the floor. If we get the right committee of the whole amendments or the right amendments, I could be convinced. But at this point, it will be a no, because the bill as it stands, I believe, it is too broad and opens up too many doors, and perhaps put patients at risk. But with that said, further comments, committee? Okay, let's do a vote, please.
Mr. Chairman, do I read this as the original House Bill 27 then? This is for original House Bill 27. Senator Bouchard.
Aye.
Senator Furphy.
No.
Senator Hutchins.
Aye.
Senator McKeon.
Aye.
Chairman Baldwin.
No.
House Bill 27, 3 ayes, 2 noes.
Okay, thank you very much, committee. Involved parties, you're all expected to get together, whether that be in a meeting, in the break room, whatever, but if you're going to work this bill, we need to make it more effective, in my view, my humble view. It's 9:20. We have limited time, but let's get started on the next bill if we can. Go ahead and come on up, Representative, and realizing that we have at least probably a dozen people online to testify and several people in the room. Up to you whether we get this done or not. But go ahead and present the bill. Welcome to Labor and Health in the Senate.
Thank you, Mr. Chairman and members of the committee. I'm Representative Rachel Rodriguez-Williams with House District 50, and this morning I present to you and move House Bill 92 for your favorable consideration. I'll briefly describe the bill, and then you can decide if you'd like me to walk you through it or not. House Bill 92 is referred to as a trigger bill. Essentially, this bill is an abortion ban in waiting, and it's a piece of legislation that if enacted, would ban abortion if the Supreme Court overturns Roe v. Wade and leaves the decision of abortion back to the states. This legislation would put Wyoming in with several other states who already have legislation in place to protect the unborn upon the reversal of Roe v. Wade. This bill limits the circumstances under which an abortion may be performed, except when necessary to preserve the woman from a serious risk of death or substantial and irreversible physical impairment of major bodily function, not including any psychological or emotional condition. This bill also limits the use of appropriated funds. Furthermore, it provides a delayed effective date pending certification by the Wyoming Attorney General. The vast majority of Wyomingites support life from conception to natural death, and this proactive legislation would prepare the way for what we can only hope would be the court's recognition that all life, at no matter what stage, is precious. And ladies and gentlemen, I just ask for your favorable consideration to move this bill unamended, and I would stand for any questions and whether or not you want me to walk you through the bill.
Committee, are you comfortable with not walking through? But I think it's a pretty straightforward bill. So are there any questions for the representative? Seeing no questions. Thank you, and stand by.
Okay.
Okay, we're going to open this up. All the departments have left, so we have no departments unless there's one online that wants to testify. I believe we have no departments, so we're going to open up to legislators first. Are there legislators in the room who wish to testify? Representatives aren't jumping up here. They don't like these seats up front. No, Representative Larson in particular is shaking his head very strongly, no. Okay, and Representative on the back row, Representative Nyman, now's your chance. I knew it. We could persuade him up. Go ahead, sir. You thought you were hiding back in the corner, I know. Go ahead, sir. Welcome to Labor and Health.
Thank you, Senator. Appreciate the opportunity. No, I'll take 30 seconds of your time. I fully support this legislation. I fully support this opportunity for folks to be able to have the right to life. And so all I would tell you is thoughtfully consider that and give those that are in the womb just as much security and safety as those are outside of it. So this is contingent upon a Supreme Court decision. So this is just placing Wyoming in a position where that attitude towards life is ready to receive that opportunity to promote that in our state. So I would appreciate your thoughtful consideration of this legislation.
Question.
And for any questions.
No questions. You can go back to your seat in the back.
Thank you, Senator.
Thank you very much. What we're going to do, if you remember the last time, our bill, what I did was 2 online, 2 in the room, alternated back 4. So let's start with 2 in the room. And we're not going to talk opposed or proposed. Let's just go ahead. 2 people jump up into seats, please, if you want to testify to the bill. Don't be shy. Introduce yourself and go ahead and testify to the committee, please.
Okay, the green light's on. Good morning, Chairman and members of the committee. My name is Greg Hunter from Laramie, Wyoming, and this is my second time testifying against this bill. After my first testimony in front of the House Labor Committee, I was approached after the meeting and was told that this book says, "Thou shalt not kill," followed by a rant about the antipope. I wanted to say that, yes, this book does say that, does say "Thou shalt not kill," but it clearly would never acknowledge the exceptions to that commandment. And the Hittites in Deuteronomy were slaughtered, and innocent men, women, and children were drowned during the so-called Creator's flood of Genesis in 5. So thankfully, our Constitution is not based on the morals in this book. Our Constitution is really a guidebook on what it is to be a good neighbor, even if that neighbor is the government. A good neighbor would never ask whether one is pregnant. And those that are voting to make the state do something a good neighbor would not do are voting for tyranny, not for democracy. Voting for this bill means you're voting against the constitutional right to privacy, 4A, so eloquently described in the compromise called Roe v. Wade. Support the entire Constitution, please, including the separation of church and state. I will stand for any questions.
Questions, committee. Senator McEwen.
Thank you, Mr. Chairman. So what I heard you just say, kind of you spoke out of both sides of your mouth.
I don't think I did, sir.
Support the
Keep
whole
it through the
Constitution.
chairman, please.
Okay.
Support the whole Constitution. Which if we look in chapter 1, section 38, it clearly defines this is unconstitutional. And then you said the Constitution, and here's where I took exception to what you said, is a guidebook. It's not a set of principles. It's a guide. But when the guide fits your needs and saves what you call our democracy, which is really a republic, I'm lost. Thank you, Mr. Chairman.
Thank you. Further questions or comments? Go ahead, sir.
Well, I can't quote the exact 128 or whatever they're quoting. I will say this is a guidebook about what it is to be a good neighbor. And I'll ask my neighbor, to clean up the dog crap that he put in the side yard. I'm a good neighbor and they're a good neighbor. But to ask whether somebody is pregnant, that goes beyond the pale. In other words, somebody will say, well, abortion's not in the Constitution. Phones are not in the Constitution either. But nobody thinks the government should have the right to listen into my phone conversation. I don't believe, and Roe v. Wade clearly says, and even Roe v. Wade in page 156, when you get down to it, says, we could have held that the right to privacy extends all the way through pregnancy. And that's what should have been decided. That's why Roe v. Wade is a travesty, because it eroded the right to privacy. I support the right to privacy. I support the Second Amendment. You will not find me to be a hypocrite on the thing. Okay. So I just wanted to state that clearly, that I do believe you're voting against the Democratic Republic of the right to privacy when you vote for this trigger bill. Those are my beliefs. Thank you very much.
Okay, thank you. Next testimony, please.
Good morning, Chairman Baldwin and committee members. My name is Tara Muir. I am the Public Policy Director for the Wyoming Coalition Against Domestic Violence and Sexual Assault. I'm also an active member of the Wyoming State Bar, and I work for survivors and our network of programs and shelters across the state. Our programs talk to victims of these violent crimes every day in every county. We don't want to take up much time. We do want to let you know our coalition recently voted to stand in opposition to House Bill 92. It requires a 2/3 vote of all our programs to take a business position on a bill like this. It's a new step for us to enter the fray of these debates, but it is important that you all know that if Roe v. Wade is overturned this summer, this bill will remove critical options for victims in very difficult and often dangerous situations. Victims are not always women, but today the topic is all about women and reproduction. Every area of a victim's life is affected by sexual violence, whether it is a child sexually abused by a family member, a teenager coerced into sex by an older man, or an adult raped by her husband. Violence increases when victims of domestic violence are pregnant. And the time when abusers most likely kill women is when they try to leave the relationship. Often women first decide to leave when they see their children are too often exposed to that violence or they become victims themselves. Advocates at our programs across Wyoming bear witness to this trauma every day. Our staff and volunteers see the torment caused by the loss of power and control over one's own body, one's most intimate self, and that is the heart of sexual violence. Our bedrock duty is to support and empower victims, to walk beside them and trust that they do know what's best for themselves and their children's safety. And most importantly, we hope to restore the notion of freedom back into their lives so they begin to see themselves as survivors and don't have to be victims anymore. Often survivors rely on their religion, their own view of God, their church to help them recover from violence. Securing their rights in any kind of reproductive or abortion care is central to continued security of religious rights and freedoms, because different religions have different stances on when human life begins. Abortion bans like this one necessarily promote one religious view over another. Our work is to support survivors, whatever their views, and for themselves and their families. We ask that you vote no on this bill. It's difficult to understand dynamics of domestic violence, often when you're not in it, but abusers often use access to birth control, healthcare, and abortion to control their victims. Rape and pregnancy are convenient tools to maintain control as well.
Okay. Go ahead and wrap it up if you would, please.
Sure. We again urge you to vote no. If this Roe v. Wade's overturned, it's akin to the ultimate power of abuse over women's lives, dictating to them their choices mean nothing, and they should be heard and believed, and we should seek safety for them. Please vote no. Happy to take questions.
Thanks for the testimony. Questions, committee? No questions. Mr. Lehman, I'm gonna have you hang tight for a minute. We're gonna take two testimonies online, and again, I can't read their names. I can see their hair color, however. One person has red hair that stands out. So we will go ahead and take your testimony first. Go ahead and introduce yourself and address the committee.
Sure.
You're
She'll have to turn
muted.
on
We
her
can't
mic.
hear you, ma'am.
Turn on your mic.
There you go. Go ahead.
Hi, I'm Rebecca Kiesling. I'm an attorney from Michigan, and I am the president and founder of Save the One, a global pro-life organization with a network of over 1,100 who were conceived in rape like me, and mothers who became pregnant by rape, who are either raising their children, birth mothers, miscarried, or they regret aborting, as well as mothers who became pregnant by incest, sex trafficking, and genocide, and those conceived in that manner, as well as hundreds who were told by doctors to abort. On our website, Save the One, we have hundreds of stories of mothers and their children who value life, who love life. And my own story is that I was conceived when my birth mother was abducted at knife point by a serial rapist. She chose abortion. She went to 2 back alley illegal abortions exactly 4 years before Roe versus Wade. And for the first, she said that it was the typical back alley conditions, as to why, like the last person just testified, would argue that she should have been able to abort me. She said it was an OBGYN's office and she had to go through the back door. And like many legal clinics today, it was deplorable. It was filthy. There was blood and dirt on the floor and on the table. And those conditions and the fact that it was illegal caused her to back out, as it did with most women. And then it was arranged for her to go to a more expensive abortionist. And this time she was to meet someone at night by the Detroit Institute of Arts, ironically next to a replica of the Rodin's famous thinker statue. She was to be blindfolded, put in the backseat of a car, taken somewhere, and then they would abort me. Blindfold her again, drop her back off. She was told that if she was further along than thought, or if there were any complications, they would have to keep her overnight. And she was afraid for her safety, but she was prepared to go through with it. And the night that she was to abort me, she spoke with this abortion doctor, expressed concern for her safety. He called her stupid. And she said, well, if you're going to call me names, just forget it. And then he went on to swear at her profusely, and she finally just hung up the phone. The next day, he called her back to try to once again talk her into allowing him to take my life for $500. And the same conversation took place, and she hung up the phone again. There is a documentary film that's the only film ever done on the back alley network prior to Roe versus Wade. And the name of this film, used in feminist studies all over the US and Canada, is called Back Alley Detroit. I could watch this film and see the men who were going to take my life. I know the time, place, manner, how much money was on my head. For some people, their near-death experience is waking up out of a coma to learn that they were almost killed in an automobile accident. And for me, this is my life-changing near-death experience. And the fact that I was younger doesn't make it any less significant, any less real. I wasn't lucky. I was protected. I literally owe my birth to legislators like yourselves who protected me. They're my heroes.
You can wrap it up for us here. We're going to run out of time, but go ahead and wrap it up.
And today, my birth mother and I are both thankful that we were both protected. I just want to point out that the last witness to testify didn't, she's not asking for women to be able to hire someone to have the legal authority to pay someone to kill the rapist, just the innocent child. And in a civilized society, we do not punish innocent people for someone else's crime. Coker v. Georgia, the US Supreme Court said that rapists don't deserve the death penalty. In Kennedy v. Louisiana, they said even for child molesters, it's cruel and unusual punishment. We know that rapists love abortion. It destroys the evidence and allows them to continue perpetrating. I ask you to support this bill with no exceptions. Currently, your law allows state funding of abortion to kill children like me in cases of rape and incest. Not only saying, I think your mother should have been able to abort you, but that our tax dollars should have paid for it. That needs to be rectified. I'm just as worthy of love and life as anyone else. And I encourage you, be heroes for other children who can one day come before you, and thank you for saving their lives.
Thank you. Questions for Rebecca, committee? No questions. We appreciate that you're here and we appreciate your testimony. I would just tell everyone here getting ready to testify, we're down to 14 minutes to hear testimony and work the bill. So keep that in mind. We're not going to stop testimony. If we haven't heard all the testimony, we will then just carry this on until Monday. So at your discretion. We have another one ready to testify online. Whose name? I can't see. I'm sorry, ma'am. With the glasses, you probably know who you are.
This
Go
is
ahead and
Dr.
test.
Jimmy D. Leeds.
Okay, go ahead, ma'am.
Turn on your mic, please.
You're muted. You need to open your mic.
Can you turn on your mic?
Ma'am, we can't hear you. You need to unmute yourself. Can't hear you.
Yes,
There you go. Go ahead. Introduce yourself.
I'm sorry. Yes, I'm Dr. Jimmy D. Lees. I'm a doctor of mathematics, not a medical doctor, just so you know, I'm not speaking as a medical professional. I am the Republican, the Wyoming Republican Women of Sheridan County Legislative Action Committee Chairwoman. I am a volunteer lobbyist to be their voice. The Republican Women of Sheridan County support the Wyoming Republican platform and legislators who substantially uphold it and bills in keeping with the platform. We have topics that we have voted to encourage, and the main one is protection of the unborn. This topic was adopted almost by a unanimous vote. We have around 150 members. In September 16th of 2019, we adopted a resolution, whereas the first timeless truth stated in the Wyoming Republican Party platform is that all individuals are endowed by their creator from the moment of conception to the moment of natural death with the rights to life, liberty, property, and the pursuit of happiness. Whereas the only purpose of government is to protect these rights for all. Therefore, it is time the Wyoming law applies these rights to the unborn. The Republican Women of Sheridan County are asking the Wyoming Federation of Republican Women and all women to show their support for legislation supporting the unborn, to vote for life, and urge their legislators to do the same. We adopted this in September 16th, 2019, and it was passed by the Wyoming Federation of Republican Women on October 5th, 2019. So I speak for the majority of Republican women in the state. We are all the voice for the ones who have no voice. If we cannot protect the most defenseless among us, then of what value are our laws? We ask that you please support this bill, and we thank you so much. Thank you for your time.
Thank you. Questions for Ms. Lee, committee? No questions. Let's move in room. Mr. Lehman, go ahead, sir.
Thank you, Mr. Chairman. I'm just going to limit my response today to the religious question, because I know that's been brought up on the Senate floor on another bill as well. In 6 years in testifying pro-life bills, I've never used a religious argument. To me, the science and technology are very clear. The unborn are living and they're human. The question that I ask is, if you're alive and you're human, if those aren't the only qualifiers that will enable you to enjoy full legal protection from the law, what's the other qualifier? And who gets to decide that question? I would say that all of your constituents would want to know the answer to that question. Thank you, Mr. Chairman.
Questions for Mr. Lehman, committee? Thank you very much for your testimony. Go ahead, sir.
Good morning, Mr. Chairman and members of the committee. My name is Matt Nadell. I'm testifying as a member of Cheyenne, Wyoming. And frankly, Mr. Chairman, members of the committee, as a member of our Republican Party, I'm embarrassed. that this bill is in front of us today. As someone who is proud to be part of this party to uphold our Constitution and our First Amendment that we hold so near and dear, we know that the most important part is our freedom from the government. What you all chose to uphold and swore to uphold as members of this Senate is to make sure that we are free from tyranny, as far as privacy and our freedom of religion are concerned. Now, our freedom of religion is not only to practice whatever religion we choose, and we all have different religions, and that's wonderful. But our freedom of religion also means that there's no religion that comes into the effect of the bills that are passed out of our government that affect our privacy. This bill is very clearly driven by an intention to affect individuals' privacy and driven by religion. As someone who joined our Republican Party, knowing what the values of this party were in the 70s and 80s and how they have changed drastically over the past few decades, it's very clear that there was no portion of our party's platform that was against abortion at that time. And it's embarrassing to me to see that members of my own party are now willing to lean on their religious morals as they pass these types of bills that impinge freedoms that would otherwise be decided within the four walls of someone's home, free from our government decisions, or your government decisions, excuse me.
Okay, sir, can I get you to begin to wrap it up, please?
Yes, absolutely. I would ask that at the very least, I would agree with some of the other testimony today that maybe the government should not be funding some of these abortions, but it certainly should not be banning something that are decisions to be made within the four walls of someone's home, especially when that bill is based on a religious freedom, a religion that is driving this bill and religion that is something to be made, a decision to be made within the walls of someone else's home. Thank you.
Go ahead, Senator McKeon.
I'll be very quick. First of all, this has nothing to do with privacy. Nothing whatsoever. There's no reporting requirements if you're pregnant or any of that. What this boils down to, and it's not religious, it's constitutional. Article 2, Section 38, Paragraph A says all life shall be protected. It's legal. It's not religious. And I would argue with you that the Republican Party platform has been anti-abortion since before the early 70s. But at the end of the day, don't characterize this as religious. It comes down to one decision. When do you believe that person is alive in the womb? And if you kill that person in the womb and you believe it's a person, it's murder. So what you're saying is if I want to kill somebody in my own house, I should have the right to privacy to do that. At what point in time is it a life and not a life? It boils down to that simple argument. This isn't about people forcing you into a religion or forcing you into a party platform. It's simply, when does life begin? And after you answer that question, that's when murder begins. Thank you, Mr. Chairman.
Okay, brief comments if you want to proceed, sir.
Thank you, Mr. Chairman and Senator McCowan. I would respectfully disagree that although Article 2 that you just mentioned does protect life, and I would agree because you read that directly out of the Constitution, we know that, and you know that as legislators, that our Supreme Court here in Wyoming and of the United States protects privacy. The privacy to make our decisions for healthcare. And that is exactly what this bill is about, regardless of whether you characterize that or not. It is my choice, or not mine, because I physically am not capable of having an abortion, but women who are have that choice, and that is their private choice. And what you are choosing to do is take that choice away from them. And we know that the Constitution was passed long before that Supreme Court decision. That Supreme Court decision still stands. And as a result, that privacy to make your own healthcare choice still stands. And I would ask that this body of government not impinge on that privacy choice, as you would not impinge on my right to own guns within my home.
Okay.
Thank you.
Yeah, you can follow up, but we're at risk of having to go to Monday now. But go ahead, sir. Go ahead, Senator McKeon.
Basically, what I'm hearing from you is I can commit crimes and I don't have to admit it because it's private. Thank you, Mr. Chairman.
Okay. I believe we're moving online now. I would remind everyone, we're down to 4 minutes. So we're within one testimony of having to move this to Monday. So online, we have 2 people there. I suspect we're looking at moving this to Monday because we're just not moving, but let's go ahead and online, go ahead. And again, you might have to help me, Mike. I just go ahead and pick a name.
If
And
Ambria would undo her mic, she can speak.
Hello, everyone. Hi to the chairman and the committee for which we're speaking to with this bill. I am going to be pretty brief, so hopefully that'll help us not get to Monday. I am in opposition of this bill for several reasons, many of which I'm sure folks would disagree with. One of the most significant is that I have been on both sides of this issue. I have been a person who has gotten an abortion, and I have also been a person who has delivered 2 wonderful, beautiful children. And in that opportunity for me to deliver those children, both times I had retained placenta that almost costed me my life. I feel that the way we talk about pregnancy, specifically the language in this bill, overshadows the fact that hundreds of people die giving birth each day. And although I made an intentional and deliberate choice to give birth to my children, I think that putting my life for risk in that context deserves me being able to make an intentional decision to do so. I have a lot of other perspectives, but the most important part is that I oppose this bill, and I'm grateful for the opportunity to have voiced my opinion. Hope y'all have a good day.
thank you very much. Questions, committee? Okay, we're going to take one more testimony online that's available, and then we'll talk over what we're going to do, committee. Go ahead, ma'am.
Mr. Chairman, thank you. My name is Riata Walker. I live in Casper, but I'm a Wyoming native from Leiter, Wyoming. Thank you for the opportunity to speak to this committee today about an issue that is as personal to me as it comes, and I apologize in advance. This may be a little long. I have a lot to say, and I'll talk as fast as I can. My husband and I had to make the hardest decision of our lives a little over 2 years ago.
Ma'am, hold up
Yeah.
for 1 minute. If you have a lengthy testimony, we would prefer that you hold that if we go to Monday. Right now, I want brief testimony, but if you've got something brief, go ahead, but
I
otherwise.
kept it to 3 minutes at House Committee, if that's okay.
Okay, fast 3 minutes, go ahead.
Thank you. My husband and I had to make the hardest decision of our lives a little over 2 years ago for a child we desperately wanted. We had a termination for medical reasons, also known as a TFMR. We found out a little over halfway through the pregnancy that our daughter was very sick. We were sent to Denver and still never dreamed we'd end up losing her. After further testing and diagnosis and conferring with our doctors at maternal fetal medicine, we were presented with our options. None of them involved us bringing our baby home. Our daughter had rare severe heart defects and chromosomal issues, a fatal diagnosis. We were told we could try to carry to term, putting me at greater health risk, or we could terminate the pregnancy either by the surgical procedure, also known as a D&E, or by induced labor, which is what we chose, but it's still considered an abortion. I have since learned many parents in this position are not even offered that as a choice. When all of your options are terrible, you try to pick the one that will cause the least amount of suffering. We chose to suffer so that our daughter didn't have to. So we induced labor and she was born early so that she could pass peacefully in our arms. We were able to organize her baptism and we were able to hold her and say goodbye in our own way. Her life was honored in the best way it could have been, all while my health was the top priority of the medical team. I don't even know how to explain to you what it feels like to go from planning your baby shower to planning how you're going to say goodbye and what to do with your child's remains. What it's like to walk into a hospital pregnant, knowing you won't be walking out with a baby. You get home and you pack away all the baby things you've been collecting because it's just too painful and you don't know if you'll ever get another baby to use them. And then your milk comes in and you now have to deal with that on top of the pain of losing a very much wanted child. I'm telling you all of this so that you might understand these decisions are not made lightly, and they are so complex and unique to every situation. Not all aborted babies are unwanted, and not all abortions are done the same way. These are real people facing real challenges, and one size does not fit all. My husband and I had to weigh so many different factors once we knew our daughter's fate. And we had to think about our home, our finances, jobs, future children we may have. The list goes on. No two families are in the same situation. And while you may think you'd have made a different decision, you aren't living their life. So I am pleading to you all, please leave these decisions to the parents and their doctors, because no one is more invested in that child's well-being than them. And they are the best people to make those medical decisions. I agree with a lot of the points already made, so I will skip those and just add in conclusion, we are Wyoming, and in Wyoming, we trust our neighbors to do the right thing. Trust us to make the right medical decisions for our family and keep our government focused on real issues like balancing our budget, building infrastructure, boosting our economy, etc. I ask that you vote no to House Bill 92. Thank you.
Okay, thank you for that testimony, ma'am. We appreciate you coming to visit with us today. Committee, I will tell you that I've got at least 2 or 3 more sitting in the room that want to testify and several more online. With that in mind, we don't want to limit testimony. We're going to continue this until Monday morning. Monday morning at 8 o'clock, we will bring House Bill, I already forgot the number, 92. Excuse me. No, we can do it at 8 o'clock. We will limit testimony on Monday if we have to, but we will continue this subject of House Bill 92 Monday morning, Representative. Can you be back with us on Monday morning? Yeah, don't go anywhere because of the snowstorm. We hope you can get back in. Otherwise, those who were unable to testify today, we will be back in Monday in the same room to hear the testimony. And we apologize for having to do this, and you knew that was going to happen. The first bill went a long time, but we appreciate everybody that came to testify. Emotional issue, both sides. We've dealt with this many times, and we appreciate the testimony and appreciate everything that's everybody's gone through. And I would tell you that I'm going to get emotional, so I'll just shut up. Okay, so we will see you